Have you had to wait too long or pay too much to see a medical specialist recently? Too many people have to make the choice between waiting months, sometimes even years, to see a specialist in a public clinic in a hospital, or having to pay to see someone privately. The issue is that Medicare rebates haven't kept up with CPI for decades, and so fewer and fewer medical specialists are able to staff public hospital clinics. 2/3 of specialist appointments in Australia now involve an out-of-pocket cost, and sometimes that out-of-pocket cost can be hundreds of dollars. Private health insurance doesn't cover GP or specialist consultations, and many people, especially older people, just don't feel comfortable asking a doctor when they go to see them how much it's going to cost them. To address this problem, the Morrison government spent $24 million setting up a website so that you could find out how much specialist appointments were going to cost you. But only 70 of the 11,000 medical specialists registered in Australia registered for that site. So every year, 1.9 million Australians skip specialist medical care that they need, because they either can't access it or they can't afford it. We need to train more specialists, but government doesn't decide that. Specialist training positions are decided by the colleges and then by public hospitals, which often struggle to pay for them. So what do we need the government to provide in terms of our healthcare? 3 things. We need to have transparency around the very high out-of-pocket charges that some specialists charge. We need to have more training positions for specialists in areas of need. And we need the government to invest more in specialist clinics in public hospitals and to give more supports to GPs and to specialists.